evidence-based psoriatic arthritis treatments?
Well, those are the treatments that we recommend because there are studies that have shown that these treatments work at reducing inflammation and that they improve long-term outcomes for patients. So they're really based on scientific evidence that have proven that they truly make a difference.
Okay. Explain to us what non-steroidal anti-inflammatory medications, pain relief medications, steroids, explain what those are and when you use them.
So they're part of this group of medication that we call their symptom relief. We use them in addition to other medications that modify the underlying disease for the purpose of helping to improve the symptoms. And so they will improve pain, reduce inflammation, but they don't prevent joint damage and they don't affect the long-term prognosis of it. But they're still really important. They're really important if you're experiencing a flare-up and you need sort of a short-term control of your pain, or early on while you're waiting for the other medications to fully take effect, where you have that period where you need some bridging help.
And you've mentioned the medications then that treat the underlying disease process and therefore also treat symptoms. And they're generally known as conventional synthetic DMARDs, or disease-modifying anti-rheumatic drugs. So explain the differences between those two.
So what all of these have in common is that they work by interfering with the autoimmune reaction that's causing inflammation in the body. And by doing that, they improve the symptoms. And at the same time, they prevent the damage to the joint and the progression of the disease. And then the difference between these categories is how they're synthesized and what kind of molecule there are. So the conventional ones can be synthesized and are a pill that you take. The biologic are usually produced by a cell and they need to be injected. And both the biologic and the targeted are very targeted in their action into a specific part of the pathway of the inflammation.
Okay, and the targeted small molecules, those are pill form.
And those are pill form.
Pill form. So conventional, biologics, and then targeted.
That's right.
Yeah. Do psoriatic arthritis patients actually take their medication exactly as prescribed?
We know that it's difficult for patients to take medications exactly as prescribed. In fact, the study shows that about a quarter of patients don't, and who knows, it might even be more than that. And you know, it's difficult to follow a specific regimen, and there's a number of things that might play into why people are not taking them. Life gets in the way, you forget. If you're not 100% comfortable with it, there might be sort of reason why sometimes people are not completely taking them, or they might be experiencing side effects. There's you know, it's not easy to take medications as prescribed.
So one of the things that prevents people from taking their medications, apart from not remembering, is their fear of side effects.
Yes, very much so.
You probably hear this a lot.
Totally.
So what are the most, you know, if you just think of the sort of the kind of three major things for people to know about side effects that would help them be more comfortable taking their medication?
So, you know, the first thing is people always think about the side effects of the medications, but there's also the side effects of the disease. So untreated disease has side effects and complications that are really important, and that the whole reason why we prescribe a medication is that the disease effects outweigh the medication side effects. Otherwise, we wouldn't be prescribing that medication. So think about the consequences of not treating the disease, of ongoing inflammation. So that's probably the first. Yep. The second is well, first of all, a side effect, sometimes people think when they read all this, oh, if I take this medication, all these things are gonna happen to me. So side effects are potential things that may happen. And usually there are side effects that are more common, but that are usually quite mild or not as worrisome. They may be unpleasant, but they're not as worrisome or as high a risky thing. And then the more worrisome ones are usually very rare. So it's a way of evaluating risk based on the likelihood of it happening and how severe it is if it does. But I think the most important thing about the side effects of our medications is that we can mitigate that risk. And we mitigate that risk by monitoring. So if you get your blood test done regularly, we are usually able to pick up things early before they have bad consequences. And if we stop or reduce the medication, it's reversible.